Online therapy was a logical step in the world of psychological intervention. Impossible before the age of computers and the internet, it has several historical precursors. Almost every pioneer of therapy at some time communicated with his or her patients using letters. Indeed, skilled letter writing was once such a common practice amongst professionals, such as social workers, that the therapeutic gains or losses of letters are taken for granted by most. The same held true for telephone conversations. An ill-timed or ill-advised remark by a mental health practitioner could set a patient's progress back immediately. Skillful use of telephones have been proven to save lives over and over again. This is of course the traditional medium of the Samaritans and other helpline services that provide solace and guidance for those in urgent need of help. In many ways, emails are similar to posted letters. Indeed, the very terminology used to describe email is based upon an analogy with the real-world postal system. Communication is faster, it's true, but all the other disadvantages of real-world mail are present. Just as in the case of a real letter that gets lost in the post, an email may not arrive at its destination. It might be intercepted by a spam filter, or an inquisitive system manager were you unwise enough to engage in counseling via a computer on your employer's network. Despite these problems, more and more people are engaging in counseling via email. Quite simply, it's more convenient than going to a therapist's office, and there are several other advantages. Email, however, may not be the best choice for those seeking online counseling. Why choose a system that lacks immediacy when two alternatives are available? One reason is that an email can be written at any time of the day or night. You can get your problems off your chest without the need to book a prior appointment. You have to wait for a reply, of course, but ventilating feelings onto the computer screen may help you immediately, especially in the early days of contact with your online therapist. From the therapist's standpoint, the email provides an opportunity to craft an informed message. Many therapists worked this way in the past using letters. Michael White and David Epstein, who founded a school called narrative therapy, are notable examples. Such emails or letters take time to write if they are to be fully effective. Emails may be combined with video attachments that are specially crafted by your therapist to provide you with a therapeutic message. A video has similarities with email. The difference is that rather than writing a message, your counselor records a special video for the client. This may be a talking head or a text presentation made in similar ways to those used in seminars and lectures. More immediate online media are the text chat and video conferencing. Most of us are familiar with text chat. Someone types into a box on a computer screen or even their mobile telephone, and this is exchanged with replies from their therapist in what is nearly real time. This process may seem unattractive as an option, but there is some evidence to support its efficacy. Between 1964 and 1966, Joseph Weizenbaum, a German-American author and professor emeritus of computer science at MIT, wrote a script called Doctor for a computer program named ELIZA. The program simulated, rather imperfectly, responses that seemed to have come from a Rogerian counselor. Weizenbaum and his colleagues were astounded to discover that this program was taken seriously by many users who would open their hearts to it. He started to think philosophically about the implications of artificial intelligence and later became one of its leading critics. As he later pointed out, we should never allow computers to make important decisions because computers will always lack human qualities such as compassion and wisdom. These are, of course, two core qualities that most seek when searching for a counselor or therapist. Nevertheless, the fact that many were engaged by simple text messages on computer screen highlights the potential for the method. Video conferencing is the method most similar to meeting your therapist in her or his office. The communication occurs in real time, and unlike psychoanalysis, it's possible to see the reaction of your therapist. She or he also is able to see and hear you, if you have an inexpensive webcam and microphone plus some free software. A few skeptics will argue that problems due to bandwidth or server capacity may interfere with the ability to connect with your therapist at a predefined online appointment time. Whilst this may occasionally be true, people also encounter emergencies in the real world. Cars breaking down, traffic, or even bad weather can delay people, causing them to break appointments. On the other hand, your online therapist is available in the comfort of your own home or any venue where you may be confident that your network connection is secure. An online therapist is far more likely to be able to provide you with a full hour of her or his time, even if you start half an hour late because of problems outside of your control. Maybe you will start late, or perhaps they can reschedule you sometime later the same day. No one will see you as you enter Dr. B's office, prompting gossip about how you may be coping at work or at the state of your marriage. Moreover, if you live in a rural area, this may be your only means to access qualified counseling help. It happens that I live on a Mediterranean beach with my husband and small child. Unlike a city-based therapist, I no longer have to struggle through the smoke and traffic and arrive at an office stressed and half-dead before listening to your concerns. Which kind of therapist would you prefer to treat you? One of those who rent offices and treat the work as a 9-to-5 job with all the disadvantages that it entails? The alternative available, thanks to internet technology, is one of the thousands of online counselors who work from comfortable bases and choose their own hours. These professionals have both the time and resources to be connected to colleagues in the profession because they can travel to conferences easily without having to interrupt the ways they routinely connect with those whom they serve. Like it or not, the world is changing. City-based therapy is expensive, time-consuming, and frequently inconvenient. Office or hospital-based therapy is essential for those requiring medication or suffering with life-threatening illnesses such as anorexia or a chronic delusional psychosis. For many, however, counseling and therapy online is a proven and preferable alternative. You and your loved ones are significant. To receive regular tips to help you achieve more autonomy, visit my page.